Knock, knock. Hi, my name's Jenna. I'm your nursing student. Can you please verify your name and birthday?
Joseph Smith, 9/29/05.
Okay, I'm going to check your wristband here. Good. I will provide privacy. Do you have any allergies?
Nope.
Okay. I will do hand hygiene.
Make sure our J-tube's ready.
Once I have hand hygiene, I will make sure I wear gloves when appropriate, and I will check the provider order. The provider ordered IV fluid, so we'll get that started today. Are you in a comfortable position? And then once my patient's in a comfortable position, I will check all my supplies, verifying the expiration date of everything, which everything looks good. I'll make sure my patient's hand is in a dependent position, and I'll make sure to have this laid down under my patient before we get started. Once that's all good, I will start with my J-loop.
We would label it with initials.
So first I will make sure this stays in and stays sterile. Before I do that, I will get the bubble out of this. Good. And then once that's out, I will apply it here.
Great job.
And I will flush it through. Good. Once it's flushed through, I'll put that back in.
Yeah, I'd rather just get it done and I think just run through it. I watched
And then next I will apply my tourniquet to select the vein that I'm going to use. Once I've found the appropriate vein, I will take the tourniquet off. I will verify that my needle is the correct size for this today. And then I will put my gloves on. And I will alcohol swab the site that I'm going to use for 30 seconds. Once 30 seconds are up, I will let that dry. And then next I'm going to open up my appropriate needle. And when I open it, I'm just going to inspect the bevel, making sure that it's appropriate, which it is. And then once I do that, I will reapply the tourniquet, keeping the sterile site untouched.
It should say on your keyboard.
And then it's inspected good. I'll place my non-dominant hand holding the skin taut. I will insert at a 30 to 45 degree angle, and I will let my patient know I'm going to be inserting now. Once it's inserted and I get a flash of blood, I will lower it parallel and insert 1/2 centimeter more. And if I don't get a flash of blood, I would redirect the needle. I will insert the catheter. And once I hear the click, I'll release my tourniquet. I will make sure this is ready, keeping it sterile. I will take this off here, and I would make sure I have a gauze there to catch the blood that's running, and attach that. I will pull back for a flash of blood. Got that, and then I will insert 3 to 10 milliliters in.
So I have my J-Loop, it is not expired.
Once that's inserted, I will make sure I keep that secure, and I will lock this.
Not expired either. And then I have my saline syringe solution that is not expired. I also have an alcohol front pad to sponge feed site.
Once that's locked, I will secure this with tape here. I will apply the Tegaderm.
Get my saline solution out. Prep this, get the blood. Okay.
I will apply the Tegaderm to the pink area in case we need to reattach
Everything in
anything.
there to keep everything, the other tip's sterile, as that is what's going in the IV.
And then I would
Flush my J-Loop to make sure that the fluid goes really through, and it does, so that is ready to go. I've moved it over to the other side. I'm going to open my phone.
I would apply tape here so that I can
Site that I want to
release this.
stick the middle through. The vein. All right, so.
And then
we're
I
gonna start
would
going with
label the Tegaderm with my name, date, time
processing.
of insertion, and the site of the needle, or the needle size. I will clean up all my supplies, put my sharps in the sharps container, ask my patient if they're comfortable, and if I can give them anything else before I go today. No, and I will come back to check on the insertion site.